in this recording, what we want to do is introduce folks to Devoted Health and the opportunities that they present for us in the state of Florida. We have a grand opportunity, I think, in a very strong Medicare market to make a difference for the folks that we visit with, and this is something that we've been looking forward to for quite some time. Premier Marketing is, of course, a national organization with contracts in all 50 states. We have a portfolio that appeals to the Medicare demographic, and what we look to do is make available through independent insurance agents a variety of programs, but in particular in key markets, organizations we view as key partners to help us help people in that market as Medicare beneficiaries look for options for coverages, not only during the open enrollment period, but all year long because of the special election periods that are so prevalent in different parts of the country and across the country as well. So at this time, I'm going to introduce the VP of Sales for Florida for Devoted Health, and that's Mr. Jimmy Feliciano. And we'll turn the presentation over. I'll actually shut up, I guess is the way to put this, and ask Jimmy to come through and give us some information about what Devoted Health has to offer and how we go about accessing what we need to do to be a factor in the Florida marketplace. So Jimmy, it's all yours.
John, thank you for that fantastic introduction. Really happy to be here speaking to your agents and those out there selling in Florida. So I've been in the Medicare industry for 16 years and been with Devoted for about 5 years now, this coming May. Started here when we had 0 members. We're currently the fastest growing Medicare Advantage plan nationwide and in the state of Florida. And it's been wonderful, really, just to see the growth and the excitement here at Devoted, and also externally with those who are selling and interacting with Devoted on a daily, weekly, monthly basis. What I would love to do today is just talk a little bit about our website, the different tools we have available to brokers, and the different ways you can sell Devoted in the state of Florida. I'm going to share my screen, and I'm going to start with what we call a top 10 document. So give me one moment as I navigate this. Well, folks, again, thank you so much for joining us here to learn a little bit about Devoted. Again, we've been in the business for 5 years, and we started in Florida, and today we're in 13 states. And as I said before, the fastest growing Medicare Advantage plan nationwide and in the state of Florida. We had a fantastic AEP, and our goal is to engage you and to work with you so you can learn a little bit more about Devoted and consider selling Devoted to your prospects and your members of Medicare business. I wanted to share with you our screen, some of the resources that we have available to you as you embark on selling Devoted. So I'm at devoted.com, and it's a really simple website, simple tools available to you to navigate. One of the first places I want to go to is, if you see here on the screen, there's a spot that says For Brokers. It's a perfect spot for you to go. And I'm going to scroll down to where it says View Plan Documents. So depending on where you're selling, whether it's inside of Florida, outside of Florida, any and all of the plan documents related to our summary of benefits, the plans available in your service area, can be found in this section. And all of the plans available in those service areas can be found in this section as well. I'm just going to choose one here in Florida. So give me one moment. I'm going to scroll down to Orlando as an example. And in Orlando, we have 5 plans. We have a standard core HMO plan. It's your typical 0 premium plan. We have the Devoted Essentials HMO plan. It's the give back plan for us in Orlando. And we have a dual plan in Orlando, and what's called a Prime plan and a Devoted Choice Orlando PPO plan. So these are the 5 distinct benefits and plans that we offer here in Orlando. Most of our markets will have 5 distinct plans. Some only have 4, depending on the market that you're looking at. For the most part, some of these plans are similar really across the state. We like to make things simple and easy, like I was saying before. So if I were to look at, for instance, the Devoted Core Orlando HMO, when I go into this section, I can look at the summary of benefits, easily accessible to you. Our core zero premium HMO plan also includes a healthy food card that can be used at Publix, it can be used at Walmart, and a number of other retail stores locally. You have the over-the-counter catalog, you have what we call the devoted dollars, evidence of coverage, everything, again, that you need to be able to sell Devoted, all the documents you need to be able to present the plan that you're interested in sharing with the prospect, all available right here on this tab here under brokers, devoted documents, and then again, search for the specific product that you're interested in. So in addition to this, I wanted to share with you some of the websites that you can use here on the website that are easy to navigate, such as finding a provider. Again, when you go to find a provider, you select the state that you're in. In this case, I'm using Florida. You also want to select the plan type that you're going to be selling. Some of our networks are different based upon the plan type, specifically around whether or not you're selling an HMO or PPO product. And then under where it says browse by, you want to select the type of specialty that you're looking up. I'll give you an example. One of the things our prospects look for a lot here in Florida is dentistry. So I'm going to apply that as a filter here. And I will use a zip code in Orange County as an example, Orange County, Orlando. And there you'll see all of the dentists within a given or specific area, usually within 5 miles. Some of the things you can do with the lookup tool here, which is pretty cool, is you can go to this part here, and if you wanted to subtract or remove any specific group from the lookup, let's say, for instance, you want to remove Greenberg, you can put a minus sign, type in the word Greenberg, and give that a second here, and it will remove all of the Greenberg doctors from the list. If there was any particular group you didn't want to look at because you need a prospect preferred not to look at that group, you can remove them from the search and really hone your search to the groups and providers that the prospect is interested in looking at. So we make it, again, really simple, really easy to be able to navigate or look at providers and pharmacies here online. Another thing to look at when using Devoted.com is how easy it is to actually look up your prescription drugs. One of the things we're known for is a zero premium or zero cost share for all insulin that's covered by us as a tier 3. So I'll give you an example of that. And that's across all of our HMOs, by the way. So if a person has Novolin, Novolog, if they're using the vial or the pen, it's a zero cost share on all of our HMO plans through the coverage gap. So we make it, again, make it really simple to be able to look things up. So I'm just going to put here the zip code. Again, I'm going to use Orange County, and I am going to, in this case, look up our zero premium HMO. I'm going to submit that, and let's say I look up something like Humalog. Now, we don't cover Humalog, but the cool thing about our formulary lookup tool here is that you can see all the covered alternatives that Devoted has. So again, you can go here to Devoted.com, you look at the drug, and these are all of the tier 3 covered alternatives that we cover. And all of these prescriptions would be a zero copay through the coverage gap on any of our HMO products here at Devoted. So we make it simple, again, for you to be able to look these things up. If you were to click on the prescription of choice, for instance, Novolog, you'll see here that based upon the plan you selected, that it's a zero for a month's supply. So again, we reiterate that here. One of the cool things here also with our formulary lookup is that you can save the list of drugs that you look up. And you can print that into a PDF and save it in your folder for your computer. I would encourage you to do that. It's a great CYA. If the member ever calls into Devoted and says, hey, my broker never looked up this drug, and if you provide this list, it's a great way to protect yourself. It's a great way to show that you actually follow the process. You looked up all the drugs, that you did the right thing for the prospect, for the member. So you can do that here through, again, devoted.com. Number of other things available here for you at devoted.com. I'm going to go back to where it says for brokers. And I know most folks today have a third-party platform for enrollments, something like Connecture or Sunfire, other Medicare Shop, other types of platforms to be able to enroll their prospects. If you ever wanted to go into our agent portal, it's a simple process to be able to log into this as well. So I'm going to go ahead and show you how that looks. When you click on the agent portal, you'll come to a spot that will ask for your NPN number and your date of birth. That will be what you need to actually get into the portal. Just a moment while it filters in. This is what the portal looks like. So for those of you that, even if you use Connecture, even if you use Sunfire, or Medicare Shop, whatever platform you're using, you'll be able to go into the agent portal. You'll be able to navigate and check all of your clients that are in the portal. Of course, I don't write business today, so I don't have anything here. But the great thing about this is that you'll be able to view the status of each client, whether or not they've been approved, they're pending, it's been canceled, whatever status they have, that's going to be here. You'll also have their member ID number on here. You'll have the plan effective date. So lots of great information. You can also view your applications as well. And you can also download your book of business if you needed to download that for some reason. So again, really, really great, useful portal to be able to go into. You can check Medicaid for those that are looking to confirm dual status. There's other reports available here. If you do events with us locally, I'd like to invite you to do that. We actually have local community outreach specialists that will work with you to help you build your business. We have events at retail facilities, at pharmacies, at clinics, at 55 plus communities. We have events really all throughout the state of Florida. And we're always looking for brokers that will actually plug into those events, work those events for us. You'll be able to get leads from that and really build your book of business for yourself and also for Devoted. So if you're interested in doing that, please send me an email to jfeliciano@devoted.com. We'll possibly put that in the chat. I'm not sure if John can do that for me. Put that in the chat here so that everyone has my email address. Again, jfeliciano@devoted.com. We would love to work with you in the community. You can actually go in here and see all of the events that you have scheduled with us. This is an example of what your events would look like. So you can add them here. You can submit an event request right from the agent portal. So you want to do a seminar, you want to do an education event for those turning 65. Again, really, the sky's the limit in terms of what types of events and what types of things we can do locally, given that it falls within the guidelines that CMS has given us for sales and educational events. Once you do your event or submit your event request, your event, once it's approved, will show up in this bucket here. All of the leads that you get will show up also into this bucket here as well, so that you can actually track what leads, what prospects you were able to talk to through the events that you do with Devoted. So that's available to you as well. We also have a neat feature here where you can submit a help ticket. So if something's not working, something's not functioning the way it should, you can create a help ticket. We usually get those resolved within 48 hours. You can email us at agent-support@devoted.com, or you can pick up the phone and call us at 1-800-1-877-764-9446 for agent support. You can also just click this button here and get information to the local sales team. So you have a local leader contact sheet here. want to know who your broker manager is for, let's say, Broward County, you can look here, you can look up that broker manager. Want to find out the date, or Jacksonville, wherever you may be selling, whatever county in Florida you may be selling in. We have a leadership contact list here. We have agent support again, and member service guides, contact information, and all of that there as well. So all of it in one neat place to make navigating Devoted, selling Devoted simple and easy. You can actually also look at the payment calendar for 2023. Here at Devoted, we pay commissions weekly. So if you sell an app, let's say for March 1st effective, within a week or so, you do get paid. You'll see the payment calendar here so that you know exactly when we'll be dropping those paychecks into your bank account if you're selling Devoted. You can also sign up for our trainings. We have trainings monthly that we do on different things like how to market yourself as a broker, how to use our tools as we're talking through right now to sell Devoted, how the benefits work, all of that, depending on the types of things you might need and throughout the year. If you scroll down, we have everything again here in a neat, concise way to make it simple and easy for you to navigate. You can look at the plan documents page we were looking at a minute ago right from your agent portal. You can search providers right from here, your prescription drugs, get the enrollment material you need to be able to enroll members, look up benefit information based upon zip codes, so on and so forth. We also have a broker manual. We have other learnings and tools available for you to be able to navigate when you're selling Devoted. I would say that one of the best feedbacks we've gotten from brokers is that the reason they sell Devoted is because A, great benefits, B, great service. Anytime anybody calls 1-800 Devoted, they get a real human being, typically within 30 seconds or less, who's going to help them navigate questions, concerns, issues, and usually resolve that issue on the first call. A lot of our members call our service folks guardian angels because that's how they operate, and they treat them like mom and dad. So they treat them in a very personal, respectful way. So those are some reasons people sell. Another reason brokers say they sell Devoted is because they love how easy and simple and fast it is to use our tools to sell the product. Doesn't take a lot of thinking. It doesn't take a lot of prep work to be able to sell Devoted. As long as you can go on our website, devoted.com, you can click on the agent portal if you need to. All of the tools are there. Looking up providers is simple. Looking up our drugs is simple. Getting in contact with someone that can help you, also simple and easy. So we make that whole process from beginning until the end a seamless process so that you can sell without having to think about or prepping for that interaction. So again, I recommend you to go to devoted.com, use the tools we have available for you, peruse our benefits, our documents, so that you can see how sellable the product is and how easy the process is. So in addition to having this portal available to you, we also have a marketing portal that I want to share with you. And the link is available on devoted.com. The link is also available, as you see here, through the agent portal. We also try to make it simple for you to sign into any portal that we have. I know how hard it is to keep track of your passwords and your usernames across really all of the plans and all of the things that you're doing out there. So we've made that process simple and easy as well. All you need to get into your agent portal, as long as you're certified and appointed with Devoted, is your NPN number and your date of birth. You click continue, and then you log in and you'll see something like this. Just give it a moment. And when you get into the marketing portal, it shows up like this. A lot of great stuff here for you to use. We have something called the Star Sellers Program. So if you sell one app or 5 apps, you get a few dollars credited to your account. And these are known as co-op dollars. You'll see them at the upper right-hand corner. You'll need some of those dollars for some of the giveaways or items that you might select within the marketing portal. If for some reason all you're doing is coming here to get enrollment kits, you can order that at no cost. So let me show you how to navigate that. Again, number of different categories here that you can use across the board. Maybe the most useful one for you, at least to start out with, is the enrollment kits. You can come in here and select the state that you're selling in and order the plans that you're most likely to sell. So keeping with my theme of Orlando, I'm just going to click here, and you'll see all of the plans available that we sell in Orlando, both in English and in Spanish. And again, pretty simple to go through this process. Let's say the give back plan in Orlando, the essentials plan. What you do is add to the cart what you want and the quantity that you need, and add it to the cart. And then you can select go into the cart and check that out. Typically, it mails and will arrive in your home typically within 5 days is what I'm seeing. So you can check out. It's also going to give you some recommended items when you do that. Two items that I would recommend as well. One is the OTC catalog. We have over 800 products or items on the OTC catalog, both generics and brands, and we offer OTC benefits really across all of our product lines in Florida. And then the dental guide, I definitely recommend the dental guide. As you know, when seniors go into the dentist, a lot of times they perform services that aren't covered by the plan, and they'll call you and say, "Hey, I thought this was zero cost," and they're having to pay out of pocket because the code that the dental or that the dentist submitted to the plan was not covered by the plan. And so the dental guide will actually give them the codes that are covered for their plan in their specific service area. So I would order one of these with every sales kit and give one to each and every prospect, just so that they understand what codes are covered by Devoted. I would encourage them to take the guide to the dentist so that they share with the dentist, "Hey, these are the codes that my health plan covers. If you're going to do anything outside of this, please speak to me first and get my permission before you do." It's a great way just to make sure they hold the dentist accountable and avoid any unnecessary or odd costs that they're not expecting as well. So you can order your kits here. Again, going back to the home page here, you can go back here, and you can also order giveaways. So I want to show you that. So we have plenty of assets for the field. Okay. So promo items, you can go in here. If you have credits in your account from your sales, you can use those credits to get giveaways. And we have 3 categories of giveaways: general giveaways, mid-tier giveaways, premium giveaways, and a lot of the things that maybe you're accustomed to in the Medicare world, things like pens and keychains and activity books. By the way, these activity books are fantastic for events that you do with seniors in the community at 55 plus communities. We have something called a scratch and win ticket. We have Devoted heart pin, grocery tote bags, number of different items, promos that you can access if you have some credit or co-op dollars. If you don't have those dollars and you're doing an event with us, you just let us know. We could help facilitate some of those items for your Devoted event. So really great tool, again, that you can use for marketing yourself and marketing Devoted within the community. We have things for new markets. We have field assets that you might need. So again, let's say you need to do an event in the field and you need a sandwich board, or you need it's greeting cards, all sorts of things here that you can order to be able to do your Devoted event effectively in the field. We also do of $32, but if they qualify for extra help with prescription drugs, that premium, they get 100% allowance, will be reduced to 0. So again, using the scenario we're talking about, where large quantities of people are going to be losing Medicaid in the state of Florida over the next 12 months, a lot of these folks won't re-qualify for Medicaid, but they'll have low-income subsidy, and typically that's not, they don't have to re-qualify for that, or the redetermination process for that's typically 2 years. So So great scenario here. You have that situation. It's a zero premium for folks on 100% of LIS. And the Part D deductible is not applicable to folks who have 100% LIS, so that's zero as well. And what you'll find is that this program is actually a great alternative for folks that were duals, who are on the dual plan with everything being zero, because this plan has pretty much zeros across the board as well in terms of cost share. So you'll see inpatient hospital coverage is a zero copay per stay for folks on this plan. You'll see outpatient hospital coverage. Then at an ambulatory surgical center, zero copay, $25 if that takes place in the hospital setting. Observation stays are zero copay. You'll see here as well, primary care and specialists are zero copay. So you get the theme so far, right? So if someone's a dual today, loses it because they no longer qualify because the public health emergency is coming to an end, they still have 100% subsidy LIS, they can still get the zeros that they were accustomed to paying with the devoted prime plan. Again, a little different depending on the market and the facility you're selling in, but keep this plan in mind as that emergency comes to an end. Emergency care is $120 copay on this plan, and that is worldwide coverage. Urgent care, though, is a zero copay, so if they go to Centricare in Florida or another urgent care facility, no costs for that. Diagnostic service done at an outpatient facility, you'll see here again, zero for labs, zero for x-rays, zero for radiology, zero for diagnostic tests and procedures. So again, if they're doing it at an outpatient or freestanding facility, no cost to them, there is a minor copay, as you see here, of $25 if they go to a hospital setting to do these services. You see here for hearing aids, low fixed copays for hearing aids as well. They have two options, the advanced option or the premium options. That's one of the great things about selling Devoted. You can actually get hearing aids at a fixed copay, so you know exactly what your cost is, complete price transparency. And as a broker, you can go to truehearing.com and you can look at two categories of hearing aids, advanced hearing aids and premium aids, and see all of the hearing aids that Devoted would cover for that copay. You're going to find it's an amazing deal, amazing benefit to members. On this plan, you get a total of $2,000 per year for comprehensive dental services. All of those services are ordered or given at a zero cost share. So again, deep cleanings at a zero cost share, extractions, full mouth debridement, dentures, root canal, so on and so forth, all at a zero cost share for members. We had a pretty rich allowance for eyewear as well. And again, you'll see the zeros here for outpatient mental health care and inpatient mental health care. For the first 20 days, there are copays for days 21, 44. After that, a zero copay as well. Physical therapy in a freestanding facility or office setting, zero copay, $15 at the hospital. So as you're looking at this, again, for those who are losing their Medicaid but retain their low-income subsidy, the Prime Plan is a really unique plan locally that you can offer and that will offset some of their costs. Their Part D for tiers 1 and 2 is going to be a zero copay. Prescription drugs, as I told you before, on all of our HMO plans are zero copay for insulin that's covered by us. And then versus paying 25% for other brands, they're going to pay whatever their LIS subsidy level is, whether it's level 1, 2, or 3. You definitely want to take a look at that. So really, really great benefits on the Prime Plan. And again, just to restate, insulin, and this is applicable to all of our HMO plans, all select insulin with Devoted on all of our HMO plans is zero copay through the coverage gap as well. So I wanted to briefly share this with you so that as you're thinking about or as you encounter folks that no longer qualify for Medicaid but have Medicare and have prescription drug assistance or low-income subsidy at 100%, then the Prime Plan becomes a fantastic, really, alternative to consider. I am going to stop sharing my screen here. Let's see. All right. So with that, I'd like to conclude our time. I wanted to be brief and to the point, making sure that you guys understood some of the benefits of selling Devoted and some of the things that we had available. Thank you so much for joining us today. And John, thank you for this opportunity. Always great to be able to connect with you and work with you.
Thank you, Jimmy. I've got a couple questions, if you don't mind.
Sure. Yeah.
Bear with me. One asks, is the Jupiter Medical Center a participating provider in the PPO?
Jupiter Medical, I would have to double check that and follow up with you for sure.
Okay.
For sure, off the top of my head.
We will do that. And an adjoining question, kind of on the same line from Chuck. On devoted.com, there's a search for providers, but cannot search for hospitals.
You can, yeah. That's actually there as well. Let me show you real quick if you don't mind. That's okay.
Yep.
Give me a second here. All right. Let me share my screen one more time. And all right. And so when you go to members, find a provider or pharmacy, again, select your state and your plan type. I'm just going to put HMO here, submit. There's a spot here where you can go under other healthcare services or places. You can go to places and you can select hospitals under places, apply filter. And if you're in Orlando or anywhere, you just put in the zip code, it'll show all the hospitals nearest to you. We have a pretty broad and large hospital network. We have most hospitals throughout the state of Florida for the most part.
Awesome. Thank you for that. One of the other questions is, if we have prospect data in the database, is there a way we can delete that, or is that there for in perpetuity?
You're talking about in the agent portal?
Yes.
Yeah, no, that's there in perpetuity. It's always be able to see your prospects and their status.
Okay, I think there's probably some compliance pieces to that as well. And that's one of the things I wanted to congratulate Devoted on, is of course the agent support that's there, and making agents realize that you don't have to reinvent the wheel. You guys have a lot of it laid out for them, and that's a great help, I believe. And for some of us that perhaps we're a little slower learners than others, you do have a great guide to the portal on your website as well. And so we'll make certain that folks have access to that. In kind of summation, one, thank you, Jimmy, for the presentation. Perfect, exactly what we were looking for. Wanted to make folks aware of the fact that there are certain advantages to working with Premier, with Devoted, and that is a variety of programs that will come to you as part of the follow-up. But a couple of things I wanted to mention, because Jimmy did allude to them a bit in the presentation, and that is the use of our Medicare Center platform that has multiple functions on it. It is the tool that our agents have access to without cost, that allows them to collect the scope of appointment and store that for that 10-year period through multiple means of obtaining that document. And the same thing comes into play when it comes to the recording of calls. I'm not yet on Medicare, but I sure get a lot of calls in the mornings about, hey, I want to help you with your Medicare benefits. And of course, none of it is compliant. And you bring up the, by the way, is this call being recorded? That normally terminates that call pretty quickly. But we have that software or that capability in that system. And if you think about what the size it takes to handle all those recordings, it's very useful. Within that document, it also, or in that tool, it also has Lead Center and other programs where you can access leads in a particular area as well. And there are a number of other programs that we, of course, offer, but in the instance of making this more brief than some of my usual carryings on, at this point in time, all I would like to do is invite you to partake of the benefits that are available to your prospects and clients in the state of Florida through Devoted Health. We ask that you, as you come on this presentation, not only if you've worked with Premier in the past, and I have the opportunity to thank you for that business, we hope to enrich it with other programs that we have. But for those of you that are checking us out, There are a number of different programs I think that you can find to be very helpful, but all said and done, my biggest point is to say thank you for the investment of your time with us here today. And so let's see, we have Chuck. I think I'm going to get some specific information for you on the use of the tool to make certain that we can address any of the issues that you might be having or help direct in that regard. So all that said and done, until we're able to speak with you again in the very near future, I thank you for your time and I wish you good selling. Thanks so very much. We'll talk to you very soon.